and as always, thank you for watching us here at Palos Heights Community Channel 4. My name is Carol Steffen, on camera with Carl Gurman. We've been invited in to talk with Dr. Mary Peterson, and we're delighted to be here, and thank you, who is standing to my right. Dr. Mary has a chiropractic, there's so many things that you do. There's chiropractic, there's acupuncture, there's...
I do a lot with foot orthotics, spinal bracing, just pretty much helping people maintain their function and independence so that they can age and perform gracefully.
I've become such a believer in alternate medicine. You know, I found it to be successful for me, you know, and I know many people that do too. People at one time thought of chiropractic were a little off base, you know, but that was many, many years ago. And you've certainly become very renowned and very respected. In fact, I think you also staff hospitals, don't you, the chiropractors?
Yes, in some hospitals they do have chiropractors on staff. The thing with chiropractic is that there was a recent study that was published in 2009 in the American Family Medicine Journal that showed that it's far superior to treating pain syndromes, back pain, things like that, and surgery without a doubt should be the absolute last resort.
And I concur. I absolutely found that in personal experience and family experience. We're here at Great Lakes Health and Wellness, and it's a chiropractic and acupuncture rehab site. Right?
Correct.
And we're at 7250 West College Drive. So it's on Route 83 on the north side of the street. Very easy to find, and lots of parking.
Oh yeah, plenty of
Lots
parking.
of parking.
Yep, and we're just behind Lake Catherine.
Okay, and we will post this all on the tape that runs, and we'll put the hours and different things that you're available. I just find what you do fascinating. I've become such a believer, I guess, in chiropractic and hands-on.
Well, chiropractic is a wonderful modality to use to help patients with pain, and acupuncture as well. With the acupuncture, it's over 4,000 years old. And to think of how that fits into modern medicine is very mechanistic. They try to test things in the blood. Well, a lot of the conditions that I treat cannot be tested in the blood. For instance, you can't do a blood test for low back pain. Perhaps you can do imaging, but you cannot do a blood test. So what happens is a patient will go to see the family physician, and they, of course, want nothing to do but to help their patients, and they might prescribe a pain medication. Well, our goal is to try to intervene before they need that medication, so that we can help avoid the unnecessary, addictions that come along with some of that as well.
And we're reading so much more about that, the opioids and everything that gets hooked on medicines and back pains and things that last a lifetime.
Oh, yeah.
Trying to treat this. It's just such an interesting thing to explore. I love that your mission statement is life without pain.
Oh, yeah. Life without limits, life without pain.
Really.
We want people, we need to age gracefully. We're living longer. There's more we want to do, and we need to learn to do it gracefully, and we have the tools here to help people do that. And regardless of what you might hear, surgery is invasive. There is no such thing as minimally invasive surgery. So starting with something like physical medicine and acupuncture and avoiding the opioid pain medications is our goal, to help patients. And even if patients do become addicted to the opioid pain medications, in the Asian medicines or the traditional medicines, they've learned how to help people with those addictions through various protocols. The NADA protocol, there are a couple of other protocols, and it's very powerful. And over my shoulder, you'll see the auricular therapy, which is ear acupuncture. It's a microsystem in the body. And with those microsystems, we can treat the microsystem to help the patient balance the energy in the body, because Asian medicine, chiropractic, it's all energetic. It is not mechanistic.
Explain the meridians.
So there are 12 meridians. They kind of flow like channels or rivers throughout the body, where one ends, another begins. And what we try to do is balance the energy through the various meridians so that people can function healthy and normally. It's all about energetic balancing. Think about balancing fire and water. That's kind of what acupuncture will do.
Actually, it makes sense. It really does. And I've seen such success. Such success.
Yes.
Try to say that 4 times.
Easy for us to say.
Not me, obviously. But anyway, it's a wonderful thing to be able to and have it be so accepted now and in prominence. And what's helpful about it is when you come in and you have a treatment to back pain or neck pain or nerve, something like that, and you can go home and relax and do some exercises or heat treatments or something to keep it going. But when it comes acute again, you're there.
We're there. And it just,
Yeah,
it,
I
you know,
that's
it's,
great.
you're not, you know, when there's an instability that's creating pain, it's something that's been there for a while. We have to break that cycle, and that's what we try to do. We try to address it at 3 different levels. At the superficial level, which would be the skin, the middle level, which would be like the muscles, and then at the deep level, which is the tendons and joints. So as we are able to do that, and that's the chiropractic and the rehab and the soft tissue therapy, and then with the acupuncture, we're able to balance things energetically as well. Because pain just isn't one thing. Pain can be chemical, it can be emotional, and it can be physical. So we try to address all those 3 different things at those 3 different levels to help the patients achieve their goals.
And I can imagine that some of your patients are becoming younger, and I know the older people need you, I need you desperately, but younger and younger. I'm seeing these kids in these darn backpacks that are on their back and on the front now. I've seen them where they balance and stuff. That's got to be dangerously dangerous to them as they get older.
Well, that's part of the physical part of it, and yes, we do treat a lot of that, especially with overuse type injuries, with kids who play sports, whether it's volleyball or baseball or softball,
Or
soccer, any repetitive type of motion, they will become subject to abnormal stresses on that area and what we call a subluxation. So on the other level, with the acupuncture, we're able to treat energetic imbalances in the body, such as irritable bowel syndrome,
Really?
allergies, headaches, you name it. It's amazing, and it's so powerful because, again, we're treating it on a different level. We're treating it on an energetic level to balance the energies of the body, whereas with pills and potions and lotions, you're treating it more on a mechanistic level. So it's something completely different. It's a completely different approach. It's a fresh approach and a different approach, but they've been doing it for thousands of years.
Isn't it amazing? You know,
Oh, well, and you can't poo-poo it. When people say they don't believe in it, there's plenty of research out there to show that it works. Exactly how it works, we don't know.
And I was reading something that caught your website is excellent, by the way.
Oh, thank you.
Yeah, we'll put the website on the tape that you'll be watching, and I wouldn't hesitate a moment to tell, it's very full of very, very good information. There's also a newsletter that
Oh,
you can
yes.
sign up for. And how often does the newsletter come out?
We send that out monthly.
Monthly?
Yes.
I keep writing myself notes because there's so many things I wanted to ask about. Home management of pain. Address that for me.
Well, that's where the durable medical equipment, TENS units, things like that come in.
I'm
So,
not sure what that is. What's durable medical
so
equipment?
durable medical equipment might be a knee brace or a back brace or an orthotic or something to help the patient function at home. The whole goal is if you can't stand for 10 minutes, I want you to be able to stand for 20 or 30. Sometimes the patients need assistance with that depending on what the problem is. If they've got an instability in their spine, these things just help them function a little bit better, and they're not surgical. So it's very important to investigate all opportunities available out there before you have to go under the knife.
If they wanted to come and see you, Dr. Mary, how will you go about doing that? Do you have, they can make an appointment, you can do an overall exam?
Well,
or-
they can do it online. Typically,
really?
Yeah,
Okay.
yeah. Well, they can request one online. They can call the office 708-371-6114, and Doug, my husband, helps me run the office.
Okay.
Or they can send us an email through the online portal, through my website. And we try to get them in, if the pain is that severe, we try to get them in the same day.
Oh, really?
So,
Okay.
But we're available 5 days a week to answer the phone. See, now I'm stuck now.
Yeah, it's contagious.
It is contagious.
It's just an amazing field. I find what you do fascinating. Maybe
Yeah.
because I know so little about it, but every time I look into it or I experience it myself, I'm just amazed at how successful it can be.
Oh, and it's very powerful, and there are a lot of other things that come along with it. Diet, lifestyle, previous injury, just to
sure.
name a few. So, and it's not so much that you have to be open to it. You just have to understand that it works, and we've had great success with it, and patients do well. Now, when there is a degenerative condition, it's not a cure. What we try to do is slow down the progression of a condition. As long as we can slow down the progression and you can function, and do things well, maybe not the way you were when you were 19,
Really,
but then, that's the whole goal, helping you age well, be well, and live well.
Well, that was kind of professed to me very, very recently, that don't give up. You know, you live your life, forget your age, try to keep your breast healthy, and keep on with the activities that you can still manage.
Right, and I like to tell all my patients, and motion is lotion. If you don't keep moving, you're going to, you don't move it, you lose it.
The old adage that is very, very true.
It is.
Tell me, how about insurance? Is insurance cover this?
Most insurances will cover chiropractic. Now, we're all familiar with deductibles and copays
Yes,
and things like that. So once those are satisfied, then the insurance will kick in its portion. With the acupuncture, some insurances do cover it, some do not, but it's very affordably priced, and we know pretty quick what kind of results we're going to get. So
I think I also read that you do therapeutic massage.
yes,
Tell me about that.
Well, we do the therapeutic massage. Part of that includes one of the Asian techniques of cupping. Cupping was something that you saw in the Olympics with Michael Phelps when he had the big red marks.
Oh my gosh,
Yeah.
yes, yeah.
Yeah, so we incorporate that, and plus
And
we
now
do.
what was that for? That was,
Well, the way that they describe it is to decongest the tissues. It's like a decompression, it decongests, and what it does is it pulls the toxins that are deep inside the body out through the skin. And so that's why you end up with those welts, and eventually over time with enough treatments and sessions of cupping, you won't develop that bruising anymore.
okay.
So
that was quite an interesting thing to observe.
yeah.
And they went on to try to explain, what had, and he was very devoted to that.
Yes, it's powerful. They've
Yeah.
been doing it for thousands of years. Of course, today the cups we use are very different than the bamboo cups and the other things that they used, 4,000 years ago. But it still is a very successful technique, and I'm very happy to be able to offer it to my patients. So, and we also incorporate a lot of Chinese massage, which is called Tui Na. Tui Na and chiropractic are very similar. It's hard to separate the two, but the Tui Na aspect of it is like trigger point therapy, what we would call in Western medicine trigger point therapy,
Okay.
stretching, things like that.
Can you just come in for a therapeutic massage?
Well, it needs to be scheduled because,
okay.
we have availabilities, and sometimes I'll do the massages. My assistant, Joanna, who is also another acupuncturist, she's working on becoming credentialed with the state right now, so taking her boards so she can also help with the acupuncture.
Well, as I said, I've learned so much from your website, and I was interested at the therapeutic massage. You suggest only like 30 minutes. Is there a reason
Right.
for that?
Yeah, because when we're working on an area, the tissues, you want to stimulate circulation to the area, which we do. You want to carry nutrition, circulation to the area, and then you want to give it a chance to get rid of the metabolic wastes. If you're doing an hour massage or an hour and a half, especially in a therapeutic setting, it's too long. The patient can be way too sore,
Oh, okay,
and
okay.
it's overdoing it. A half hour, really, that's what you need, especially on a problem area.
Okay, okay. Okay, you can find Dr. Mary Peterson in the phone book.
Yes.
You can certainly find her on her website. Take a look at the website. I think you'll be firmly convinced, at least to take the next step. If you're in need of maybe a little help, I would suggest that just Dr. Mary Peterson is the people to come, or the office to come to and learn more about it. Thank you for inviting us in.
Thank you so
It's very
much.
educational. I love talking with you, and I loved your website. They also have a newsletter that you can sign up for, too. And as always, thank you for inviting us into your home.